Thank you, Mr. Chairman, and thanks to all the witnesses today. Thank you for your time and expertise. Mr. Chairman, I'd like to enter into the record two things. Number one, a full report from Johns Hopkins. It's a literature review and meta-analysis on the effects of the lockdown on COVID-19 mortality.
So ordered.
And also an article by Paul Best with Fox News summarizing this. And just a couple of highlights in this. It said that the lockdowns only reduced COVID-19 mortality by 0.2%. But there were some unintended consequences of this. Then many of these things have been highlighted so far today. The astronomical increase in opioid deaths, over 100,000 in 2021. Also an increase of 8.1% in domestic violence reports after the lockdown orders were issued, and the fact that 97% of U.S. teachers said that their students had experienced learning loss during the coronavirus pandemic. These are some devastating and unintended consequences of what is a real overreach of the federal government into people's lives. I want to speak.
So ordered.
Thank you, Mr. Chairman. So I want to speak or talk about this from the standpoint of being a parent and someone in a community that has dealt with mental health issues. One of the areas that hasn't had a lot of discussion today, and one of the real deficiencies that I see, is the real problem that occurs when there's a crisis moment with a young person, when they either tell a counselor or they tell someone at school that they intend to harm themselves, and they go immediately into the crisis mode. They go to the emergency room, sometimes waiting 24 to 48 hours to have someone evaluate the young person. Then there's the problem of trying to get them into an inpatient setting for stabilization, and then there's a real gap that occurs from the time that they leave the inpatient setting into when they can get into real long-term counseling, whether it's in person or whether it is in whether it's remote learning. On telehealth. So I think that while we've talked a lot about access to care, and we've talked a lot about telehealth, and and there are just a plethora of comments and reasons why this has been exacerbated, and clearly the workforce issues around having enough providers for mental health treatment are real. I'd like to hear from the witnesses on this crisis moment that seems to be even worse in rural communities. So, Ms. Avula, if you could comment on that or give me your perspective on the real gap that exists in that crisis moment, the acute problem, and the transition from that to a safe environment to long-term treatment. If you could address that, I would be interested in your comments.
Sure. I think one of the issues, the major issue here, and you've characterized the issue quite well, and I think all states are facing this, is that there is not a substantial community-based mental health infrastructure system across the country. So what happens in a moment of crisis, people call either the police or they take their child to the ED. The vision of 988 is that you should be able to contact this phone number and you should be able to be connected immediately to mental health services. I have deep hope that that will work. The problem is, if a child needs very acute care, you still need a place to be able to take that child. So there are things like emergency respite. There are things like mobile crisis teams. There are things like that can be put in place in communities that will help alleviate the moment of the crisis so that the child can be stabilized and not, withstand and 48 hours is likely on the shorter end. Children are spending way more time in EDs. So we need to be able to immediately get the crisis moment stabilized. But then you're right, we do have the next problem of where do we then take the child for longer term care. So this speaks to, again, the need to continually expand and enhance the services that are being provided in the community to ensure that individuals are getting the care that they need. The other thing that
Ms. Avula, if I could, before I run out of time, I also want to point out that this is a real problem moving from in rural communities, because most of these treatments facilities are in metropolitan areas. There's certainly not enough capacity in the rural areas. And all of a sudden, someone's got to be transported by an ambulance to the facility. And the parents or the caregivers or guardians are then sometimes hours away, and they've got to go back and forth. This is a real concern. And I think if we're going to be really effective in this, we're going to have to address this acute care problem in those crisis moments, particularly in the rural communities. And with that, Mr. Chairman, I yield back.
I thank the gentleman. Let me recognize the gentleman from Pennsylvania.